Dr. Chris. I'm a practicing chiropractor. I'm the founder of MuscleCare. I see 55,000 patient visits a year in my practice. We understand pain. If you've been diagnosed with patellofemoral syndrome, that's where the knee is just not lined up and the kneecap is grinding in its little trough, give this particular stretching routine, this mini series of stretches, to that friend, that family member. It will help them a great deal. The Super 6 rules to stretch are: warm up, be gentle, no sharp pain, breathe, always do both sides, don't bounce, and always hold for at least 30 seconds or until you feel the muscle relax. Now that you're warm, let's get some relief from that patellofemoral syndrome. For the front of leg or quadricep, we call it stretch, what you want to do is you want to make sure that you're standing holding a wall with one hand, the right hand, and then you'll pull your left heel up to your buttock and you'll grab the front of the ankle on the left with your left hand. Try to hold that foot and heel as close to your left buttock as humanly possible, and that's when you go through those Super 6 rules of stretch. Now remember, again, this may be tight, you may not be able to get it all the way there. It's not essential that you touch your heel to your buttock, just as long as you feel the front of leg stretching. Do both sides. Once we want to do our hip flexor stretch, we can roll directly from our front of thigh or quadricep stretch. We can put our right hand on a chair for support. And all we do is, as we want to stretch our hip flexor, it's important that we try to pull our left leg back. So the left thigh, you're trying to get it closer and closer to parallel to the ground as you hinge at your waist and you move forward. So when your body is really doing this well and your hip flexors are stretched out, you'll be able to make a T. Your right leg is on the ground, that's the bottom of the T, and your torso and your left thigh create the top of the T. Put that right foot up so the heel is on a chair. Start with that, keep the leg perfectly straight. Don't bend the leg. You want to stretch the connective tissue in the back of the knee. This is what everybody misses. So if you do that and you're getting used to that at that level, that height of the chair, then start to hinge at the waist and lean your body forward. Don't round the shoulders, don't round the neck, hinge forward. Put more stress on that hamstring to stretch. That's an effective way for those that have, again, balance issues or dizziness or vertigo problems. For an effective side of leg stretch, remember that the iliotibial band, tensor fasciae lata, very, very, very tight adhesive sort of tissue, because that stabilizes your pelvis so you don't fall over. So those stretches take a little longer and you've got to be patient. So you stand facing away from a wall, put your left hand on the wall, and what you'll do then is support yourself. Now your left foot stays planted on the ground. Your right foot crosses in front of that left leg. And then what you'll do is your right hand goes on your right hip and that pushes the hip toward the wall while you're stabilizing and holding the wall. This way you're going to be stable and you're not going to fall, but you're going to have to breathe deeply for at least 30 to 60 seconds. Notice I said 60 because fibrous tissue doesn't have a lot of blood flow. Blood flow brings magnesium into those tissues and helps them relax. So again, it's going to take longer than an average muscle. Do both sides. Sit torso 90 degrees to your legs, both legs straight out in front of you. So if we can take the legs out to a V shape, we can actually get the inside groin or adductor muscles and the hamstrings to stretch together. Just lean your palms onto the floor and glide out between the legs, keeping the body hinged at the waist, not rounding out. You can do this standing or lying down, but if you're going to stand, hold a chair, lift up the right knee to 90 degrees so that the thigh is parallel to the ground, and grab that right knee with your left hand and pull it so it rotates to the side. Try not to twist your upper body. Try to keep your upper body straight ahead, ears over shoulders, shoulders over hip, and twist to the side. You can do this lying down as well if you have balance issues or dizziness problems. For the standing shin stretch, if you've got knee problems and you can't kneel, this is a great stretch. Stand holding a wall, have a chair, have a couch behind you. Just keep the one leg, the balanced leg, perfectly straight. Stand up nice and tall. Bend your other knee to 90 degrees. Open the ankle up and get those toes of yours, the top of your foot, on a couch or a chair. That's gonna open up the front of ankle, and then what you can do is you bend the supporting leg a little bit if you wanna lower yourself down and put more torque, more stretch on those front of shin muscles. That's a great stretch to prepare for walking, running, and any sport going. This is a sitting groin stretch. So you sit as if you're cross-legged almost, but you're putting your feet together. You let the legs fall out, knees bent at 90 degrees. Bottoms of the feet stay together. Let the legs fall. If you want to stay straight up and down and put a little pressure, intermittently, slowly but surely on the inside of the knees, and give this time. Adductor muscles are very powerful. There's a lot of connective tissue. So even gently stretching it for 1 to 2 minutes, I strongly encourage. You feeling better? I knew you would. Listen, why don't you continue your pain-free journey by clicking the link in the description below and access my full stretching series and share the relief of pain and stress with friends and family. And you know what? If you really want to feel even better, why don't you try this? MuscleCare is the new sub-topical, all-natural, evidence-based pain, spasm, and inflammation reliever. You're going to love it. It's easy to use, simple to put on, no mess, no fuss. It's a roll-on. I'm Dr. Chris, and have a great day.